Good evening and namaste to everyone. I'm Karishma Sharma, the host of Bioanalytics and Skill Development Forum. Welcome all of you in our 21st session organized by BioPractify and the partners. As we know that heat is on the wave, heat is on the peak, and it's really important to take care of the health because a healthy gut is a key to healthy you. And when it's come to healthy gut, definitely we cannot far with the topic of microbiome because they are interconnected. But what is microbiome? How it is connected with the health? And what kind of immunity does it provide? It is important to know the answer of all such questions. If you want to know the answers, you have to remain with us throughout this lecture. Now it's time to introduce the expert who will be going to train you over this topic. So please welcome the guest of the day, Miss Abantika Ghosh. Abantika, thank you so much for doing this for us.
Thank you, Karishma. Thank you for the introduction.
Most welcome. So now it's time to give a little introduction about my speaker, who will going to give you the ray of information over the topic. So Ms. Abantika Ghosh is MSc Immunology graduate from the University of Oxford in the year of 2022. She brings over 3 years of experience in mammalian cell culture, and beyond her scientific endeavors, she has also conducted various workshops on English language test and host pathogen interactions. Apart from the same, she has also received offers from institutions like Oxford, Imperial College, and King's College London, with a remarkable 9 out of 9 acceptance rate of master's program. And apart from it, the extracurriculars that she is having, she founded as ImmuneET. She's a founder and makes a platform where she makes scientific news accessible to people from various background and age groups. I hope you will learn enjoying with her. So now it's over to you, Avantika. You can start with the same. Thank you once again.
Thank you so much, Karishma. I'll share my screen with everyone. If you can't see it, please let me know. And in case you have any questions, please feel free to ask me. Is my screen visible?
Yes, it's visible.
Okay. So hi everyone. I'll talk about the role of microbiome in immune responses. So this is a field which has recently got a lot of attention, and for all the right reasons. Previously, we did not know if microbiome inside our body has got any relation with immune responses that our body comes up with when it encounters any harmful pathogen. But today, let's delve into this domain. I don't want to go in depth so that I really want to keep it engaging. So spanning from a bit about what microbiome is, what are immune responses, I'll also be talking about a few more things in details, and hopefully that will be engaging for all of you. And again, like I mentioned, please feel free to ask me any question that you might have. So let's talk about microbiome. So microbiome is a community and an ecosystem of microorganisms which is living in a habitat among us on our body, and what they do is they work together, and this coexistence is actually very essential in shaping the immune system that we have, and also its response to all the unwanted pathogens that we encounter, as well as any unwanted unnecessary immune reactions that happen in our body. So research has shown that microbiome affects a lot of how we experience our daily lives. So it's just not digestion, but also brain function, food choices, and even our emotion. So even someone having depression or anxiety, it can be somewhat correlated to the microbiome they might have. So like I mentioned, it is present everywhere in the nose, mouth, lungs, skin, stomach, gut, everywhere. And immune system and the microbiota, they are interlinked. They develop together. This is something I'll be talking about in my upcoming slides. And I also want to mention that anything which disrupts a healthy microbiome in an individual is going to lead to responses which are inappropriate. By inappropriate, I mean it can be a pathogenic condition, or it can lead to inflammatory conditions like inflammatory bowel disease. So here is something I wanted to discuss before I begin about the immune responses that our body gives us, right? So Imagine you're walking down a road and you're wearing a pair of shoes, okay, a new pair of shoes. But what you notice is that the road was having a lot of pebbles around. So the sole of the shoe comes off all of a sudden. And now you want to have something to wear so that your feet is protected, right? So you want something which gives you that initial layer of protection. Although you might have your favorite brand, you might have a shoe size that you want, but in this scenario, you want something to protect your leg, right? So what do? So you can either, probably if you don't have anything near you, you can you wrap a plastic around your legs, or you can go to the nearest cobbler and just take a chappal. And this is how the innate immune system works. What it does is it provides the initial level of protection when a harmful bacteria or a harmful pathogen comes into our body or breaches the initial layer. So this is where the response is not specific, it's not targeted, but it is very, very essential. And without an innate immune system, without the first layer of protection, it is very difficult for an individual to survive. So if a child is born with a poor innate immune system, the survival rate is very, very low. Now what happens if you have a chappal, you walk down and then you can go to your favorite store and you can get the shoe of your choice. You can wear it and you can also choose a shoe that fits all your needs. And that is where our adaptive immune system comes into play. This is the second layer of protection, but a much more stronger. It has an immunological memory, which is what we see during vaccination when vaccine is provided, and then it gives you a memory response. So the next time you encounter an antigen, the immune response is all ready to set and to attack that pathogen. So this is how adaptive immune system works. It's very strong, it's very specific, it has a memory, but it cannot act without the help of innate immune system, which provides the first layer of protection against any pathogen that it encounters. So like I have already mentioned, this is the anatomical and the physiological barriers that we have, the skin, then we have lysozyme, which is a peptide which is there in our tears, which has an antibacterial effect. Then the stomach pH, which also kills a lot of bacteria. And then there's the innate immune cells. We have neutrophils, we have dendritic cells. And then the adaptive immunity, which is the next layer of protection, which is very powerful, but it usually happens after a considerable amount of time. Now I'll show you a video. Please bear with me. Just give me 1 second. So here we'll get an introduction of how the innate immune system works. So this is another one. The video is visible, right? Can someone please confirm?
Yes, sir.
Okay. So these are the pathogens entering your body, okay? And these cells, the macrophages, are gobbling them up. And they're sending signals called cytokines. These cytokines are recruiting other cells like the neutrophils. And then you'll also see other cells like the natural killer cells. And these all form the part of the innate immune system. If you see this pathogen, it has bypassed the innate immune system. Now the adaptive immune system needs to come into play to make sure that it curbs the entry of this pathogen. Dendritic cells, they process these pathogens, proteins of these pathogens, and what it does is it goes and it presents it. So this is called an antigen presenting cell, dendritic cells. So they will go and present it to the helper T cells in a manner similar to this. After that, the helper T cell gets activated and then it goes and it activates B cells. And we know that B cells produce what we call antibodies. Antibodies specific for that particular pathogen which was present in. And via that, these antibodies may have a lot of ways in which they eradicate this pathogen that they encounter. They might sit on the surface of the pathogen and then that might be recognized by other immune cells. So now I'll again share my PowerPoint. And I hope that gave you an overview. Now, early development, like I was mentioning, that early life is very important to microbiome and the immune system. The first 1000 days of a child's life, it determines lifelong health. Because during this time, rapid maturation of metabolic, neural, and immune pathways occur. So in this first 1000 days, a lot of factors play a role. The first thing would be the prenatal maternal factors. So maternal gut microbiota, vaginal infection, or even periodontitis. So what happens is, if there is elevated levels of prostaglandins, it can cause a mother to give birth to a child prematurely. So this prostaglandins can be labor induced, and that could be due to some bacteria which might be present in conditions where periodontitis is there. Okay, so then it could be mode of delivery, whether it's vaginal delivery or C-section delivery. Based on that also, immune system would differ between two individuals. I'll talk about that, but I also wanted to mention this, that there were studies done on germ-free mice. So germ-free mice by definition is a mice which has no microbiome compared with the regular mice. So this germ-free mice, they showed several immunological defects, including a reduction in adaptive immune cells, and they had a lot lesser number of the helper T cells, which I had shown in the previous video. So what that means is that the cell-mediated immune response and the response to target pathogens gets hampered. So now you understand that the microbiome in a body is also very much responsible for ensuring that the immune system matures properly and the immune system acts properly. So let's talk about how babies born by C-section are different from babies born by vaginal delivery. So what is noticed is that babies who are born by C-section, they do not have vaginal microbes which are lactobacillus. So lactobacillus is considered a good microbe because they are probiotics, they support gut health, they prevent infections, and they also have immune boosting activity. So this is usually less in babies born by C-section. And what they have instead is they have a much more higher number of skin bacteria. And of course, because of the delivery in which cesarean delivery is done. And there is also a delayed colonization by a bacteria called bifidobacterium. So that is also a good microbe, which also serves as a probiotic. So then there was a study done, and then the gut microbiota and the T cell response of infants who were born vaginally were compared with those born by C-section. And like I mentioned, C-section born infants had a lower microbial diversity. So that means that there is also going to be lesser number of interleukin 10, which is responsible for a lot of anti-inflammatory responses. So what that means is that in C-section infants, some studies have shown that they develop much more allergic conditions. They can develop diabetes. So these conditions, they can develop a lot of inflammatory conditions. And that could also be somewhat related to the fact that interleukin 10 is not getting produced in them enough. Interleukin 10 is responsible for anti-inflammation. Okay, so that could be one. Another thing is antibiotics. Antibiotics, like we know, they're going to interfere the normal development of a healthy microbe. So the more antibiotic exposure you have from early on, that is going to disrupt the bacterial diversity in your body and cause lower abundance of the good microbes like the lactobacillus or any bifidobacterium. So I will also talk a bit about what happens in breastfed infants. So why infants who are lesser than 1 year of age are advised to have breastfed milk is because it has got something called human milk oligosaccharides. So these are complex sugars which are present in breast milk, but they have no direct nutritional value to the infant. But what do they have instead is that they act as prebiotics. So they promote the growth of beneficial intestinal bacteria. They also promote the generation of short chain fatty acids, which are also very critical for gut health. So breastfed infants also have higher levels of, again, the good bacteria, bifidobacteria and lactobacillus. Whereas formula-fed infants, they have higher proportion of Clostridium and Proteobacteria. And these are usually associated with some or the other pathologies. Not always, but mostly. So then I move on to talk about how the microbiome and the immune system help each other, the normal immune system and the normal microbiome, okay? So the human host is providing the microbiome with a shelter. It is providing the microbiome with different nutrients. what is a healthy microbiome doing for you instead? The microbiome in your gut, it is helping you digest food. It increases the metabolic capacity of a lot of carbohydrates and a lot of plant starch-based products. It is providing vitamins. It is also protecting from the colonization of a lot of harmful pathogenic bacteria, because the good bacteria have their own colony, which is somehow protecting against anything which is pathogenic. So now I also want to mention here that 70 to 80% of the immune system we have is present in the gut. So the gut microbiome influences the immune system in two ways. One, it provides antigens that can stimulate the immune system and send signals that affect the behavior of other immune cells. So let's watch a video again. And this is a video from Nature. And this will help you understand what is really happening in the gut and how the microbiome is helping. Is this video visible? Can someone confirm that for me, please?
Yes, ma'am.
Okay, thank you. So watch this video. So the body's first encounter with microbes is through the gut. So what happens here is microbes are going to encounter the mucosa, which is the innermost layer of the gut. Just increase the speed a bit. And acidic pH usually destroys most of these, but some will make it to the intestine. So now the intestine has these structures called villi or villi, whose primary function is absorption of nutrients, but it also has a lot of immune cells. So scattered along the intestinal mucosa is what you see here, a dome-shaped structure called Peyer's patches. So these provide immune response to pathogens and immune tolerance to food. So the lymphatic, which is here, and the villi, they drain into something called a mesenteric lymph node here. And within this villi structures is a network of connective tissue called lamina propria, and at the base are the crypts. Now embedded within this matrix of the Peyer patches will be immune cells which help in the sampling of antigens like bacteria or any bits of food, whatever you're eating. Okay, and then I want to put your attention here to this cell. This is a phagocytic cell which is called M cell. This can transport material across the epithelial barrier. So these dendritic cells which you just saw here, which have dendrites, they sample the antigen and then they break it down and present it to the lymphocyte like I had shown you. So what it leads to is an event called tolerogenic activation. What does it do? It initiates anti-inflammatory response. So please remember, if whatever you're eating, if this tolerogenic response would not have been there, then your body would have reacted to everything that you're eating. So this is something which prevents inflammation from happening, which tells the body that this that I'm eating is fine. This is not going to harm my body. This is what my body needs. Okay. So here what the dendritic cell is doing is it is converting T cells into something called regulatory T cells. And these regulatory T cells are responsible for secreting cytokines like IL-10, which I was mentioning, which stops unnecessary inflammation. But now you see, if there's a condition, if there's a pathology or something that happens, then this barrier gets heavily affected. And then it can lead to pathogens just leaking through the gut epithelial barrier, an entry of microbes, toxin, undigested food, which will lead to inflammation. This is also called a leaky gut. And you must have heard this term a lot of times, but this is usually what happens during a leaky gut. And it causes these pathogens to enter, then the immune cells are going to start fighting. They're going to secrete a lot of cytokines, pro-inflammatory cytokines, which will cause other cells to come into the place of action, and then they're going to start producing inflammation. And this is what usually happens in a lot of inflammatory conditions like colitis or inflammatory bowel disease, which I was talking about. So now, again, back to the slides. Just a second. Just give me 1 second, sorry about that. Now, briefly talking about the anatomical sites and the kind of microbes that can exist. In the skin, there was a study done on 20 skin sites on 10 healthy individuals. And what they found that there were 205 identified genera in 19 bacterial phyla. And then there was a large number of fungal genera also, which was present on healthy human skin. So these fungal pathogens, they're not pathogens, I would say. These fungi, they do not really cause any harm to the body. However, during any pathological condition, any disease, there are certain genera which tend to dominate in the affected region. For example, if you see here, I have mentioned just one, Malassezia, which is very dominant in atopic dermatitis. And then there is Acremonium, which is also very dominant in dandruff-afflicted scalps. Now, coming to the conjunctiva in the eye, a very small number of microbes are found there. Usually, it's because we have lacrimal glands in the eyes, which continuously secrete and keeps the conjunctiva moist, which means that that blinking will lubricate the conjunctiva and it will wash away any foreign material. And we know that tears also contain bactericides like lysozyme, like I mentioned, and those would restrict the microorganisms from thriving in those epithelial surfaces. And now about the vagina. The vaginal microbiota are those species and genera that colonize the vagina, and the most abundant vaginal microorganisms, like I was mentioning during one of my first slides, is the lactobacillus. So lactobacillus, it suppresses pathogens by producing hydrogen peroxide and also lactic acid. So it reduces the pH and it inhibits growth of a lot of fungal pathogens like Candida albicans. So that's something we are going to see here. So this is a normal vaginal microbiota. So lactobacillus is creating lactic acid, it's lowering the pH, pathogen growth is getting affected. So it's all a normal, healthy vaginal microbiota. Now, if there's a disruption that happens, then what happens is Candida or Trichomonas, they can grow and cause yeast infections or vaginosis, and these can cause inflammation. Now talking about cardiovascular disease. So what happens is, why do people say don't eat a lot of food rich in high fat or red meat? Because that encourages growth of meat-eating bacteria, and dietary precursors like choline or carnitine, these are metabolized to trimethylamine by gut microbiota. So high levels of these are metabolized into trimethylamine. And this trimethylamine is subsequently oxidized by the hepatic flavin monooxygenases to form something called trimethylamine N oxide. And this has been seen to have a very detrimental effect on the heart. It causes stroke, atherosclerosis, and a lot of heart and, or I should say, cardiovascular diseases, which is why everyone around would ask you and advise you to not have diet which are rich in high fat foods or red meat. Now, I have already talked about microbial dysbiosis, where if there's a disruption to the healthy gut microbe or a microbe in any other part of your body, it's going to cause inflammation, and this might lead to many pathological conditions. One of them, and in severe cases, that can also lead to cancer. I'll give an example. So colon has been seen to have the highest concentration of bacteria in the gastrointestinal tract. Now, studies have shown that there's a 12-fold increase in the risk of colorectal cancer compared with cancer in the small bowel or any other part of the gastrointestinal part. So why is that so? So they have also done a few studies which have showed that it could probably be also due to the microbiome which is present in a healthy individual and an individual who has colon cancer. So their microbiome composition might differ. So that dysbiosis may lead to toxins getting in, increased permeability causing a leaky gut. It can lead to chronic inflammation, as I had made you observe in the video, and that can lead to hyperproliferation or an unnecessary reaction which can lead to diseases, even colorectal cancer. And that could be due to a lot of factors like production of carcinogens, where, like I mentioned, diets which are rich in meat and fat, they will form nitroso compounds which are carcinogens. That can also lead to elevation in damage to DNA of the colonic cells. There can be microbial metabolism that can produce byproducts which are toxic to the gut epithelium. And there could be pro-inflammatory signaling, which I already mentioned. Now, coming towards the end of our discussion today is a very important thing, which again is a very recent finding, is that the composition of the gut microbiome also has a role to play in the efficacy of chemotherapy and immunotherapy. So while gut microbiome can be detrimental sometimes, it can also be helpful. So there's a dual role and immunomodulation function of the gut microbiota in cancer. So like I mentioned, some gut microbiota which are harmful can induce carcinogenesis by producing toxic metabolites. Conversely, something which is intact, an intact intestinal microbiota, and healthy microbiota, can serve as a protective role against cancer. It will retard tumor growth, it will alter the microbial composition in a tumor and shape the tumor environment in such a way that it maintains also the intestinal and immune homeostasis and also improves immune surveillance through tumor adjuvanticity or probably antigenicity. Now, I will name drop a few bacteria which are responsible. So, Fusobacterium nucleatum, it has been seen in some cancer patients, and it disrupts tight junctions and activates what is called the beta-catenin, and that promotes the transcription of a lot of oncogenes which are responsible for cancer. Again, some people who fairly do well when they are receiving chemotherapy or immunotherapy, they have higher occurrences of bifidobacterium, and that the logic behind it is that this bacteria, they increase the function of dendritic cells. You remember the antigen presenting cells I was talking about, right? That increases the function of DCs and they will recruit cytotoxic T cells. And this is something I forgot to mention. The cytotoxic T cells are very important for attacking the tumor cells. So they are going to be there in a higher concentration in the tumor microenvironment and they are going to suppress tumor growth. And finally, just to mention one more point, is that in ICI or immune checkpoint inhibitor therapy, it was seen in a few studies that people who had decreased diversity of fecal bacterial composition or lower fecal bacterial composition, they had a lower response rate and worse patient survival to immune checkpoint inhibitor in comparison to people who had a microbiome like bifidobacterium. Similarly, in CAR T cell or chimeric antigen receptor T cell therapies, it has also been seen that gut microbiota composition is going to affect how a person is going to respond to chemotherapy or immunotherapy. So microbiome can also sometimes serve as prognostic biomarkers. Studies are still ongoing, but then we are very hopeful that it's going to be a major, I would say, breakthrough in the field. Finally, talking about what is called a fecal microbiota transplantation. It can come across as a little gross, but then this is something which has helped a lot of patients who were suffering from what we call the Clostridium difficile colitis. So in that condition, patients lose a lot of body fluid. They get infected by Clostridium in such a manner that none of the antibiotics work for them. So there's a serious inflammation of the colon that happens, and this is like a do and die situation for them. So they have to go for something called a fecal microbiota transplantation. It is still a debatable topic whether this is something necessary or not, but I wanted to mention that this is approximately 90% effective rate in eradicating infection caused by Clostridium difficile and especially colitis. So what happens in it is this is a treatment of where a donor fecal matter is given to a patient in order to alter the recipient's gut microbial makeup and to improve their health. And this can be done through a lot of process like colonoscopy or endoscopy. So this actually helps a person to get a restored healthy gut microbiome. Finally, the slide that I wanted to talk about is what you should consider, and based on whatever discussion we had, is lesser number of sugar intake, no processed food, avoid stress eating, reduce the consumption of red meat. And then what should you be doing? You should have more fermented food like kefir or yogurt, stay hydrated, have high fiber food, more roughages in your diet, and limit the use of antibiotics. I see a lot of people taking antibiotics when they have viral infections, but that's wrong, right? The only reason some doctors, so you might ask, why do some doctors still give antibiotics when I have a viral fever? So it can usually be also because of this reason, that when you have a viral fever, your immune system is already weakened. So the doctor wants to ensure that you don't have any opportunistic infection or any other infection which happens because your immune system is already weakened. But everything said and done, you should limit the use of antibiotics as much as possible if it's not required. Thank you so much for your time, for listening to my presentation, and I hope I've been able to clear a few doubts that you might have had regarding the topic, and I'm happy to answer any questions that you have. Thank you so much.
Hi, ma'am. Thank you for such a wonderful presentation. It was very informative and educational.
Thank you.
Okay, so I wanted to ask about this fecal matter transplant. So, so basically, is it like yeah, like if we are going to suppose donate an organ or something, so our body tries to reject it, right? Because of the
Yeah.
autoimmune and all. So is this the case in case of this fecal matter transplant as well?
I don't think so, because as far as I know, that the success rate of people who have had this is almost 94%. So I think I don't think there is a rejection that happens like that. And also,
And
yeah, go ahead, please.
no, please, you go ahead.
Yeah, so with that success rate, I don't think there is a lot of rejection in any case, and I wouldn't think there should be any reason for rejection in that manner also, because there's already a disruptive immune system because of unhealthy gut microbiome. So I would assume that if fecal transplantation is taking place, then it's trying to restore by giving a healthy microbiome composition. So that way, it shouldn't be having a lot of, I would say, rejection from the body. That's what I would assume, but I would definitely take a look at it. Yeah. Thank you so much for
And
asking.
you said that since it's for like, yeah. Thank you for answering. So I wanted to ask, can we also use it like for colon cancer as well, or just for like infection?
Right now, I think fecal microbiota transplantation has only been used for Clostridium difficile colitis. So only for that particular pathogenic condition, or that condition. I don't know exactly if it has been used, but I don't think so. I don't think it has been used for any colon cancer treatment. But I can tell you that FMT is something which is used. It is still debatable, but it is used for Clostridium difficile colitis. That is something that it is used for.
But we can like explore like in future research areas, or like in the future maybe this can also be explored for colon cancer, because that's kind of increasing these days, the number of patients, and
Could
uh,
be.
this will be kind of like a very non-invasive kind of like minimally invasive, as in like there's no surgery involved, right? So
It is. Yeah, that's true. I think. I mean, whatever I've read the literature and the much that I know, that it's for now used for severe cases where none of the antibiotics are working. But I think, to answer your question, definitely it is. I think it is also getting explored. But one of the reason it might not be very well accepted right now is, obviously, you understand, because it's not a very well accepted process, right? So I think that might take people
yeah,
to
mhm.
honestly accept it as a therapy. But
Yeah,
yeah.
yeah, because I know somebody who's like kind of in-law parent were admitted for this colon cancer, and I came
Mhm.
across this fecal matter transplant thing, so I suggested
Mhm.
them, but
Mhm.
I was not aware, but I thought maybe it can give anybody, like a final chance, maybe. So maybe it can be considered. But like you said, we need a broad mind to accept
Yeah.
things and take it
Yeah, I mean,
forward.
yeah, like, given the fact that it's usually not that well accepted, now they have also come up with pills instead of colonoscopy. But again, that is another thing. You don't really accept it. It has been still accepted in Western countries, but I don't think it's that well accepted here. So, but it's something that could be explored, and with more awareness, I think it can have, definitely can be used for different other
Yeah,
things.
like for cancer patients, definitely, because they kind of go through a lot, right? So they'll maybe
Yeah.
might be more open-minded. Okay, thank you for answering.
Thank you, Sushri. Okay, I'll just take.
Ma'am, I have two
Yeah,
questions.
sure, go
First
ahead.
question, First question is, inflammation is not bad also because low levels
Mm-hmm.
of inflammation is always required. That is a
Right.
part of immune response.
Mm-hmm.
So other times we think of inflammation as a bad and we try to reduce that or suppress it.
Mm-hmm.
So that is, not good, in my view.
Mm-hmm.
And the second question is, we talk about these probiotics like Yakult, orally taking them. I hardly understand like how they are important or how they are able to treat the problem because the gut, will try to destroy it also, right? Gut acids and temperature and all of them. So how
Mm-hmm.
far these are helpful, these probiotic drinks, and there are so many drinks and everyone use different bacteria. For some
Mm-hmm.
it works, some it does not work. So
Mm-hmm.
what is your view on this?
To answer your first question, which was about inflammation, like, see, I
Yes.
think obviously I agree that a bit of inflammation, like when you have an inflammation on the skin, the reason the inflammation occurs in the first place is to make sure that there's no further damage to that area. The cells come into that area, there is redness, swelling, to prevent any more damage. And then the immune system also works to get rid of the pathogen. And this is also where this is a good question, because I would also like to mention that when we are vaccinated, a lot of people think that if I'm having even a bit of low grade fever, I should have paracetamol. But they say, doctors say, if you don't have high grade fever, don't have it. That's because when you're having a vaccine injected in your body, then the immune system definitely has to react to it for an immunological response to occur, right? So there has to be some level of low grade fever that will happen. But this is the same thing, exact same thing here. A low grade inflammation is important. But when it is high grade, like if it's a high grade fever, there's a lot of other abnormalities that come into place. Your body, when it starts to get heated up after a certain temperature in a fever, you have to have paracetamol. You might lose consciousness. There can be a lot of things that can happen, right? So everything to a certain limit is fine. And when it is over excessive, like in case of allergies or in autoimmune diseases, where the body starts reacting to its own immune cells or to pathogens unnecessarily and a lot, that can cause tissue damage, that can cause a lot of other pathologies. So, to answer your question, definitely inflammation to a certain extent is good. But when it exceeds that, for example, if in an allergic condition, what happens? Your whole body starts to have, rashes. You start to in anaphylaxis reactions. You start to have problem breathing, right? And that's a very uh, fatal disease where you have to be given epinephrine to survive. So that is unnecessary reaction of the body to something which might have required a bit of reaction. So in such scenarios, inflammation needs to be controlled. When it comes to your second question about probiotics, it is again very debatable, which is why people say more than having probiotic drinks, have natural ones, which are like yogurt, and you have like kefir and all of that. Long term, I don't think there has been a study which has done a very long term study based on commercially available probiotic drinks, and there hasn't been a lot of studies to prove that these beverages will have a lot of health improvement like that. So I don't think I can have a definitive answer to that, but definitely these don't do any harm to your body, that's for sure. As long as it's a recognized, company, and but their claim of changing the microbiome might not be true, but it could be like an added thing which you can have, or a healthy alternative to have. But I don't think research, which if it has been there or done, has shown that these drinks have a lot of benefits or anything. So no, but yogurt definitely has. So it has been seen that even if your diet changes from having meat all of the days and you suddenly change to yogurt and plant-based diet, your microbiome can change in as many, I would say in 3 days. People think you have to have a lifestyle for a year to have your microbiome composition change, but it can change in as low as 3 days. So yeah, to answer your question, I don't know if that answered your question, Suresh.
Yes. Yeah.
Thank
Thank you
you.
very
Thank
much.
you. No worries.
So are you telling like prebiotics is like taking prebiotics will be better for our gut health than like probiotics?
Um, Again, so for others who might be just confused between probiotics and prebiotics, so probiotics are like supplements that will have live microorganisms, and prebiotics are foods that act as food for the microorganisms. So, like your question, Sushri, I think again, prebiotics and probiotics both are, again, if you are having curd, it has lactobacillus in it, right? So that's a probiotic as well. So I think both have their own pros. There's no cons to it that I see. And yeah, it's just that when there are companies claiming that there can be a massive change, there are no studies that kind of support it for now. But the natural alternatives are definitely something which have helped people get over a lot of inflammatory conditions. Even in these days also, if we have any gastrointestinal problems, our parents, our family members will ask us to have curd, right? So that has been I would say something which has been going on for years, and that helps. So I don't think there's anything doubtful about having curd or anything on that side. Anyone else?
I think someone has their hands raised up. So, Sai, do you want to ask any question?
Yeah. Hi, Abantika.
Hi,
Super
Sai.
presentation.
Thank you.
So my question was with respect to that vaginal delivery. What might be the observatory explanation behind the what do you call depletion or the interventions of the lactobacillus microbiota? Like, why do you think that it's the depletion takes place and then?
Okay, so what I meant during the slides was that when you have a delivery by C-section, so obviously the baby is not coming out of the vagina, so they will not be taking up the mother's vaginal microbiota, which is very rich in lactobacillus. Okay, so instead what is happening is C-section delivery born babies are taking up microbes such as the microbes present on the skin. So that way they're lesser in number when it comes to the good vaginal microbes like lactobacillus. And in certain conditions, like I said, when they're not born, when they're in the mother's womb, if a mom has a condition like vaginal inflammation or infection of that sort, then I think microbial metabolites can play a role in what is actually going to be the microbiome composition of the child.
Oh, but again, correct me if I'm wrong.
Yeah.
So the microbiota of the mother does not pass through the channel, right? The connecting the mother to baby.
Yeah. No, it doesn't. Yeah.
Okay. It doesn't pass through that. Only after the only during the vaginal delivery or during the C-sectional, this microbiota gets transferred from the mother to the child.
Yeah. Yeah. So
okay.
I would also be adding to it that almost all the studies have shown that there's no transfer in the prenatal stage, but some studies have shown that there are influences of the microbiota even in the prenatal stage, like I was mentioning in the condition of periodontitis, right, where signal, the neurons are signaled to develop the brain with microbially modulated metabolites. So what I mean by that is the levels of prostaglandins are getting higher, which can cause a mother to give birth to a child prematurely. So these prostaglandins are labor-inducing compounds which are present in, I would say, more in a certain bacterial microbiome, not bacterial, a microbiome compositions, which is why it is causing in these conditions, in periodontitis, these microbiome condition or microbiome composition is causing prostaglandins to get elevated, and that is causing a labor-induced status where the mom has to give a birth to a child prematurely. So I think that's very indirectly related when it comes to a prenatal stage where the child is not even born. So I think even when it comes to a health condition which the mom might have, or a vaginal dysbiosis which a mom might have, there might be some or the other indirect link which might influence how the microbiome might form in the first 1,000 days of the child.
Oh, okay. Thank you for this. But I have one more question with related to that. That is with respect to CRC, right? So have you carried out any mutagenesis or genotoxicity studies related to this microbial dysbiosis?
No, but there are a lot of papers, and I think there are about three nature papers that I came across last month itself, where they might have done studies on that. I'll cross check it with you, and I can send you the link. But yeah, you can take a look at it. I think there is study done. What was your question again? I'll just write it down. I'll just send you the papers.
Sure. No, because like one of my colleagues, she is working on this CRC, and she was telling that because these genotoxins such as like you see is this colibactin, right? So what happens? So colibactins of these are present in the strains. These are present in the bacterial strains of E. coli. So what happens is that you there is an induction of DNA double strand breaks, and that leads to this genetic instability, and then you see this microbiota getting ruptured.
Right.
Good work. Good work, Abantika. Thank you for your.
Thank you so much. I also want to mention that because you mentioned this, I also read about how Propionibacterium is also very high in people with stress. Yeah, so
exactly.
Yeah, I can also look it up for you about the genotoxic studies and send you a paper about that.
Okay,
Thank
good.
you, Sai.
Okay, thank you, Abantika.
Thank you.
Hi, Avantika. Prashant here.
Hi, Prashant.
Am I audible?
Yeah, you're audible.
Yeah, very nice presentation. You were just mentioning about the role of microbiome in brain disorder and depression. So could you just elaborate a bit more on that as to how the microbiome plays the role in the brain progression of the brain disorder or leading to depression?
Okay, so I think there are different reasons, but one of the reasons that I know is that the gut is also called the second brain. And it is also because that it has a role to play in brain-based disorders like anxiety or depression. So what happens is, there's the enteric nervous system that a gut has, and that communicates in kind of the same way as your brain and the central nervous system does with neurons and neurotransmitters. So every microorganism will have a different effect on the enteric nervous system. So the vagus nerve, which is influenced by the stress, it will also be connected with the intestinal cell system. So this has led a lot of researchers to believe that that might be very important in playing a role between the brain and the gut. So what we call the brain-gut axis. So I know that certain gut bacteria produce neurotransmitters like serotonin, dopamine, and these can enter the bloodstream and it can also affect brain function. So I would say these are some of the reasons which I know is how the gut and the microbiome can play a role in modulating how a person feels about different situations, how a person reacts to different situations. And we know that having so many microbes in our system means also they'll have their own genes, and how that would impact us would also be dependent on the composition that we have within our body. So yeah.
Okay, one just quick question. Is there any specific microbiome that is being studied wherein, it plays a role in this kind of disorder? Or is it like a bit more generalized when it comes to the microbiome, or is there any specific class of microbiome that actually is responsible for this?
I don't think there's going to be one specific class. I'm sure there's going to be like a composition which will have different bacteria and different microbiome would come together to play a role.
Okay.
I would not
synergistic.
It might be not synergistic also, but it might be like different microbiomes can have, or microbes can have. Sorry about that. Microbes can have different effects. They can come together and have an effect. I exactly would not be able to pinpoint the species currently. It's not at the top of my head right now, but yeah.
Cool. Thank you so much.
Thank you.
A very nice presentation.
Thank you.
Sorry to interrupt. Actually, Abantika, have you carried out any prognostic biomarker study or any finding out any therapeutic targets to understand this microbiome?
No, I haven't conducted studies on that, but that's actually something which I have seen recently. A lot of papers, if you see on PubMed, you'll come across. So I had placed a PubMed alert on it, and I saw a lot of people working on it. So yeah, might as well. We can take a look at that as well.
Oh, okay.
Yeah. anyone else has any other questions? Thank you, Rushi.
Hi, Abantika.
Hi,
So,
Vinay.
I think participants have had a blast of a session. Like, they are so interested and so curious about everything. And
Thank you.
it's a really nice session and nice presentation.